Greetings. Let us learn about gastric bypass. This is one of the commonest surgeries performed to treat patients with morbid obesity. Here is the anatomy of gastric bypass, and let us learn about these steps. This is a procedure which restricts the food intake as well as bypasses the food from the normal route, thus impairing the amount of calories absorbed by the body. Here is normal anatomy. We create a smaller gastric pouch, then section the jejunum and create a gastrojejunostomy. Subsequently, you create a Roux-en-Y Jejuno-jejunostomy. So this anatomy is very important because sometimes gastroenterologists are required to perform ERCP to remove bile duct stones. And how do we go about doing an ERCP in a patient with gastric bypass? There are two techniques. One technique is you go along the route of the different connections to reach the bile duct and then inject dye into the bile duct. So let us look at this long circuitous route: esophagus, gastric pouch, gastrojejunostomy, jejuno-jejunostomy to the ampulla, and then contrast injection and completion of the ERCP. As you can see, this is a long circuitous route. The technical success is not great. So endoscopists have come up with a new technique called the EDGE procedure. This is endoscopic ultrasound directed gastrojejunostomy followed by ERCP. So how do we do this? There are two steps. In the first step, endoscopic ultrasound, and then create a anastomosis between the gastric pouch and the remnant stomach under ultrasound guidance and leave a stent. And once the stent is left there, the ultrasound scope is removed, and then you start with the side viewing scope, go down the gastric pouch through the stent, remnant stomach to the ampulla, and inject dye to complete the ERCP procedure. I hope this is useful. Thank you.